in New York, in Brooklyn, New York. I wasn't super happy with the program, so I ended up transferring after my second year and completed my, transferring after my first year and completed my second and third year in Connecticut at University of Connecticut. I graduated from there, and then I did an imaging and research fellowship, cardiac imaging and research fellowship back in New York. And then I did a year of hospitalist medicine at Montefiore in the Bronx. And then I matched into cardiology fellowship out here in Philly. And I graduated fellowship a little over a year ago, back in 2019. And I've been practicing in Philly ever since. I have hopes of going back to Southern California, and I do, you know, like I said, I'm a non-invasive specialist, and right now I'm doing something called locums cardiology. So it's basically where you sign with a company and they outsource you to different hospitals that need to fill, you know, temporary needs. And the reason why I ended up doing that and really kind of took the off-beaten path, if you will, is because I wanted a little bit of flexibility in my schedule. I only work like 2 or 3 weeks out of the month. And then outside of that, pre-COVID, my whole plan was to, you know, travel more, be able to see my family, and just kind of get a feel of what I like in terms of what, you know, practice model I really like and ultimately want to have as a part of my life when I end up getting a permanent job. Things took a little bit of a turn, and I realized I really do want to make advanced imaging a huge part of my career. So I actually ended up applying for a second advanced imaging fellowship, and I'm going to be doing that starting in July of next year in San Diego. So I am moving back to Southern California finally, and yeah, so that's kind of been my path as to how I got to where I got to. So I don't know if you guys, do you guys have any specific questions that you want me to answer, or how do you want me to go about doing this?
People can like type in the chat if they have any questions.
Okay. So, you know, I get asked a lot about Caribbean med schools and, you know, about pre-med, you know, requisites in terms of getting into medical school, you know, what it's like to be a doctor, what it's like to be a cardiologist. So I'll kind of just touch base on some of that stuff. So, you know, in terms of getting into medical school, I mean, we all understand, and I think that most of you guys are probably in high school or early years in college. You know, it's a pretty big feat. Medical school is definitely difficult to get into, especially within the States. And if I give advice to people now, I actually advise them not to go the Caribbean med school path if they're able to get into the States. And so the reason why I say that is because, not that it's not doable, because it definitely is doable, but it's just gotten so incredibly competitive that I feel like if you get into a US med school, whether it be MD or DO, your chances after that of getting into a good residency, a fellowship, you know, everything is just kind of straightforward for the most part after that. Obviously, if you're applying to a very competitive specialty like dermatology or orthopedic surgery, you know, neurosurgery, things like that, you know, you're still going to, it doesn't matter where you go, you're still going to have a very competitive atmosphere that you're dealing with, and you're going to have tons and tons of research. And cardiology in and of itself is a very competitive specialty, you know, as well. So like I said, you know, the first things first, if you're able to get into an MD or a DO school, I definitely would advise that. There are different paths to getting into MD and DO schools, especially nowadays. It's not uncommon for people to take a year, a couple of years off after they've graduated college to do maybe an MPH or, you know, a research year or something like that to kind of get a little bit more experience, you know, some research projects under their belt so that they can be more competitive applicants when they're applying for medical school. In terms of, you know, when you're in college and you're thinking about, you know, what you want to major in, A lot of people ask like, oh, like, should I just be majoring in biological sciences? And I actually don't think you need to. So I of course, I was one of the many that majored in biosci, and that was easy just because all of my pre-med recs were already incorporated within my major. But think about all of the applicants that these medical school committees are seeing. They're seeing thousands and thousands of applicants every season, that a majority of them do have biological sciences as their major. So if you have an interest in political science or anthropology or arts or whatever it is, English, like whatever you like to do that, because all of your major is not going to be devoted into trying to get into medical school. You can just take your pre-med recs on the side, which is just going to be a handful of classes, and that should be sufficient enough for you to apply to medical school. I also get asked a lot of questions about the MCAT. It's been a long time since I've taken the MCAT, and you do need to take the MCAT if you want to get into either American Medical School, MDDO, or if you want to go down to the Caribbean, one of the better schools in the Caribbean. And so I don't know if the format has necessarily changed, and in terms of doing the prep work and such, I remember taking like a Kaplan prep review course, and I didn't really necessarily like the course itself, because I'm more of like a self-learner. So I really like the material that they gave us. So they give you like a whole like slew of books and materials to go through, and then a huge question bank to go through. And the MCAT, it's kind of like the SAT. It's like a standardized test, and they're not necessarily testing your knowledge in the sciences, right? So the way that the MCAT differs from your USMLE step exams when you're going to be in medical school, I feel like the USMLE step exams actually test your knowledge in terms of, what you're learning through medical school, whether it's step 1 and learning about the basic sciences, or it's step 2 and step 3 and learning more about clinical management and patient care and things of that nature. The MCAT is a different beast. I feel like some people are just really good test takers, and it doesn't matter how, quote unquote smart you are. If you're a great test taker and you're really great at standardized tests, good for you. I wasn't that person, unfortunately. But again, it's a doable exam. It just takes a lot of prep work and, a lot of practice in terms of trying to do well on it. I am a huge believer in people being well-rounded, right? So, when you think about what makes a good physician, it's really a well-rounded person, right? Physicians are not just all good board scores and good grades. Yes, you have to have those to get in, but that doesn't make a good physician. A good physician takes a lot more than that. So unfortunately, even though we're trying to change that, that perception, and we're really trying to, get more well-rounded people within the field of medicine, your grades and your board scores at the end of the day, those are things that, are going to weed you out, right? So it is very important to get good grades in high school. Myself in particular, I took a lot of AP classes in high school in junior and senior year. Senior year, I think I just took all AP classes, and that helped boost my GPA a lot. And then, I did pretty okay on my SATs in order to get into a good university program. So that stuff matters. But other stuff that I did, I volunteered at a hospital or two near my high school. I did some extracurricular activities. I was part of like a couple clubs or whatever on campus. I did track and field, and I did cross country as sports. I really enjoyed running, so I felt like that kind of made me a lot more well-rounded. And then in college, I did the same. I didn't do sports in college, but I did. I was a part of a couple of South Asian cultural groups on campus and had some leadership positions there. I did some, I think a couple of research projects. I volunteered again at a hospital. I was a part of a charity organization that I'm still a part of now. So, I think that those things definitely contribute, to your applications, and you shouldn't just be all boards and test scores, but, like I said, a heavy amount of your application is going to be weighted on how good and, you know, how good your grades are and how good your board scores are. Unfortunately, you know, I know we want to hear different answers, but I don't think that that's going to be changing anytime soon. All right, so wow, lots of questions here. Okay, how do you know what the first question was? Because it's not allowing me to scroll up. Just kidding. Okay, never mind. So what made you want to do cardiology? So so it's kind of funny. So when before I applied to medical school, I've always wanted to be a doctor. I was never, you know, like my family members never pushed me. It wasn't, you know, that kind of journey. I don't have any immediate family members that are doctors. My mom's a PhD. Other than that, nobody else is in medicine. And then I have like a couple aunts and uncles and a couple cousins here and there that are physicians. But I've always just had like that bug in me ever since I was like, bug is probably not the appropriate word, but you know what I mean. I've always just had that fire in me ever since I was young to want to be a doctor. I just didn't realize how difficult the path was going to be. And I actually really liked dermatology for some reason. And I even worked at like a dermatology clinic before I started medical school. And then, you know, like I had mentioned before, dermatology is an extremely competitive specialty, and especially going to Caribbean med school, that was going to be really, really, really difficult for me to do. Not that I was deterred, but then, you know, I kind of lost a little bit of interest along the way. And then I started, so in your first 2 years of med school, you're doing a lot of like science courses, you know, physiology, pathophysiology, pharmacology, things like that. So when I started to learn about, and then you're learning about all the different organ systems. So when I started to learn about, you know, cardiology in terms of physiology, hemodynamics, you know, pharmacology, I really started to take a lot of interest in it, and I was doing really well in terms of, you know, my grades and scores, and especially within cardiology. It just made really a lot of sense to me. And then I remember in my third year, I did an elective early on in cardiology with a cardiologist out in New York. And he sat with me every day, and, you know, he had to read a bunch of EKGs for the day, and he would sit with me every single day and go through every single EKG that he had to do. And this was like for a month straight. And, you know, EKGs are one of those things that even as an attending, you know, it can be intimidating, right? Because there's certain interpretations of EKGs that can just be very difficult to understand. And that's why, you know, even as a subspecialty, electrophysiology is a, you know, a 2-year subspecialty after cardiology fellowship, just because it's such a, you know, it's a difficult field to understand and to perfect. And so, you know, but after he did that with me, something kind of just clicked, and I was like, wow, this isn't as hard as I thought it was going to be. And so, and then I remember in my internal medicine rotation, for some reason, we were rotating with an interventional cardiologist, and that's the type of cardiologist that does cardiac catheterizations, where if someone like had a heart attack, they would go in and do a procedure to open up the blockage in a coronary artery. And so he took us to the cath lab, and he was having us kind of shadow him while he did a procedure. And I remember it was like this long, complicated case. And one of the things that happens in these procedures is that you have to wear lead because you have to protect yourself from radiation exposure. And so I remember all of us, you know, students at the time were in the lab, we were wearing the lead, everybody's like all hot and sweaty, and they, you know, weren't really enjoying themselves. And I remember like I was one of the few that was like totally just like wowed by everything, you know, just like I was seeing the heart in live motion, and how he was doing this procedure, and how he injected dye, and the dye was filling the arteries that supplied the heart, and he was, you know, seeing these blockages and then deciding what he wanted to do, you know, and I just started to like realize, I was like, wow, like this is such a dynamic career. There's so much that you could do in this field. There's so much research that goes into this field. There's so many different subspecialties of interest that you could do within this field. And then also, you know, personally, you know, my dad also had a couple heart issues early on when I was younger, and, you know, even up till now. So for me to understand kind of what was going on with him and how I would be able to contribute or help in any way was very important to me. So I think all of that, you know, culminated into really this like burning desire for me to do cardiology. And then ever since I, started internal medicine, so internal medicine residency, you need to have that under your belt in order to do a specialty in one of the organ systems. So there's, cardiology, pulmonology, allergy, immunology, nephrology, all of those different organ systems. You have to do a residency first in internal medicine. So I went into internal medicine knowing that I wanted to do cardiology. And I'm actually one of the, few, a lot of people don't know when they go into, their residency, what they necessarily want to specialize in. Some people decide very late on. Some people even graduate residency and work for a couple of years and then decide that they want to do a specialty. So I felt like I was kind of fortunate in that sense because I just had a direct path as to, okay, this is going to happen for me. Like I had briefly mentioned before, it wasn't the most straightforward path. And, like I had said, cardiology is a very, it's a difficult field to get into, right? It's very research heavy. They expect, publications from you, things like that. And so I knew that I had to go to a really great residency program in order for me to, match successfully into a good cardiology fellowship program. And not saying that I didn't get into a good residency, but it wasn't my top choice. And it was a community program and I wasn't happy with it. And so, early on, I knew that it's either, I have to make it happen from this place or I have to think of another option. And so I actually ended up doing something that most people don't do. And I, looked for other programs that would allow me to transfer in as a second-year resident, specifically university programs. And that's a very, very difficult thing to do because once you match into a program, you're basically signing a contract with that program. And so you're expected to finish off the whole entire, residency with them. Unless, for whatever special reason. But I was very honest with my program in the beginning and I told them I wasn't happy there and I wanted, something better for myself. And so I think when they, realized that I was being honest and about my goals, they supported me and I had to search all around the country for an open spot. It took me months to find the spot. I even let go of a contract offered by me by that specific hospital. And I was basically without a job for a few months, guaranteed job until I found this program at University of Connecticut. And, I matched there, I got accepted there for second and third year and the transition was smooth. And I'm incredibly grateful for that experience because, it was a great program. It was a robust program within cardiology. I was able to get a couple of research projects under my belt. I had great exposure there. It was a transplant program as well, heart transplant program. So I got to see a lot of more acute, sicker patients. So, that kind of solidified my decision, for me, even though it was very difficult for me to leave my friends and, for me to leave kind of my comfort of where I was and go to a place that I didn't know anybody. But I, for my career and me wanting to do what I wanted to do, it worked out. Yeah, so that's kind of my long-winded answer as to why I wanted to do cardiology and then eventually ended up being a cardiologist. So, I was wondering if you do surgery or not. I do not do surgery. So this is a common question that we get. Do our cardiologists cardiac surgeons? And no, they're not. So cardiothoracic surgeons are the ones that do open heart surgery. So you have to train as a general surgeon first, and then you can do a fellowship in cardiothoracic surgery. And you can even further subspecialize in transplant, or heart transplant and mechanical assist device surgery for those really sick patients where they need extra help with their heart because it's just come to that point where they need to get a new heart. And so those are the surgeons, those are the people that do they'll replace heart valves if the heart valve is sick. They'll do bypass if, let's say, we do a cardiac catheterization and someone has multiple blockages in their heart and it's just not going to be amenable to just putting stents in, then they'll go ahead and they'll do bypass where they'll take veins and arteries from different parts of your body and then redirect the flow so that you have, you can bypass those blocked vessels. And then they also do, things like heart transplant, remove masses, whatever, anything that goes on in the chest. I will say that there is a little bit of overlap now. So I mentioned interventional cardiologists. Now there's a subspecialty called structural cardiology, where specifically those cardiologists are now doing procedures where they also replace heart valves. And this is a newer field that's probably come about over the past few years, but this is such a huge, game changer, because a lot of the older patients whose, maybe their aortic valve, which is one of the main valves in our heart, maybe their aortic valve needs to get replaced because it's like calcified and it's, it's thick and it's not opening well. Maybe they're too old and they have too much going on to tolerate a major heart surgery. So what happens now is that you can do something called a TAVR, which is basically doing an aortic valve replacement, but you do it peripherally from a vessel. So just like you would do a catheterization through a vessel, you can do that with the heart valve procedure as well and replace the valve. And that's like a game changer. And they've basically been doing more and more studies with this to see like, okay, well, if it helps and it benefits the older patients, can it help the people that maybe aren't as sick? Can it help the younger people that need to get their heart valves replaced? And they've been doing more and more studies that have shown that, the outcomes with somebody that gets a TAVR versus somebody that has open heart surgery are actually very similar. So, this is like I said, a huge development within the field, because not everybody needs to get open heart surgery. And, obviously, if you're getting a major surgery, you're at risk of getting major complications. So it's a huge development in our field. So like I said, there is a little bit of overlap, but at least the major surgeries are done by surgeons, not by cardiologists. All right, do high schoolers need to take biology subject tests for the SATs? I think you have to take biology irregardless in high school, if I'm not mistaken. I don't remember the SATs that well to know what you have to or like what you do or do not need to take. I do remember that there is a science portion of the SATs. I may be wrong. I'm very far removed. I'm sorry. I graduated a long, long time ago from high school, so I'm probably not the best person to ask. But if biology is like a standard class for you to take in high school, and the SATs test everything that you are supposed to know in high school, then I presume that science is going to be a part of your SATs. Sorry, that's the best way I can answer that. Could I describe my average day at work? Yes, I can. So it changes, and that's kind of like one of the reasons why, I love what I do, because it's so dynamic, right? Like I can go into the hospital in the morning, I can run a stress test on a patient, and then I can go to the cardiac ICU or the intensive care unit, and I can take care of a patient with cardiogenic shock, meaning that their heart function is so poor that they're not able to perfuse the rest of their body, appropriately. So I manage that patient. Then I can have clinic the same day and go to clinic and manage someone's high blood pressure and cholesterol and diabetes and things like that. And then I can go back to the hospital and I can read a few echocardiograms, which are ultrasounds of the heart. And then I can see a few more patients in the hospital for chest pain and heart failure. And that could be a whole day, for me. I've seen, patients in clinic, but also seen, more acute care patients in the hospital. And it kind of just varies day by day. So that's one of the reasons why I love doing what I do, because it's not just one dimensional. Like I said, I definitely have an interest in imaging, and that's definitely part of my day-to-day job. And I hope that, with a little bit more training, I can do more, more dedicated imaging. But, one of the reasons why I love being a physician in general is taking care of patients. And so my interactions with patients on a day-to-day basis honestly keep me going. I could have a really bad week or a bad month, but that like one interaction with somebody where they hold your hand and they say, wow, you saved my life, or thank you so much, or, whatever it is, or just putting their trust in you, to help them, that makes everything. And that makes you realize like, wow, this is why I'm doing what I'm doing. So yeah, my day definitely varies, but even if I end up doing more imaging in my career later on, I definitely want to have some, inpatient and outpatient variability, so I can still continue to see patients. How would I describe my average? Oh, just kidding. I just said that. How did you make the choice of non-invasive cardiology? So yes, that's a good question. So, there's invasive and non-invasive cardiology. So that means you either do a majority of procedures or you don't. And then cardiologists, in general, if you just graduate after cardiology fellowship, you're a general non-invasive cardiologist. And then you can kind of have these different subspecialties. So like I said, my subspecialty is advanced cardiac imaging. So that's, cardiac MRI, so doing an MRI of the heart, cardiac CT, so doing cardiac CTs of the heart. I mentioned structural cardiology. So, you know, with the cardiologists that do the procedures, you have the imaging cardiologists that help guide the procedure through imaging. So we can do different, you know, imaging modalities to help guide, you know, a valve being replaced or a hole in the heart, you know, being plugged or whatever. We can help guide the interventional cardiologist by doing imaging, you know, side by side. So that's kind of my interest. And then, you know, what sparked my interest in imaging to begin with was because I did this imaging fellowship prior to starting cardiology fellowship. And I think the cool thing about imaging is just being able to know what's going on inside somebody's heart and being able to help manage them that way, whether they need to get a procedure done, whether they need to have certain medications, what's actually going on with them. So cardiac MRI is really cool because you really just see the like small little characteristics of somebody's heart, right? So not only do you see what the heart function is like and how the valves are opening and closing and what the surrounding structures of the heart are, what walls are moving, what walls are weak, if there's any scar in the heart. It can give you, you know, based on the different patterns that you see, can really give you an idea as to like, oh, maybe this person has cardiac sarcoidosis. Maybe this person has amyloidosis. Maybe this person has severe aortic stenosis. Maybe this person has really bad ischemic heart disease. You know, whatever it is, you can actually help guide somebody's management just by looking at, you know, pictures of their heart. And so that really sparked the interest in me. And then in general, when I did my cardiology fellowship, you know, I learned echocardiography, ultrasound of the heart. I learned nuclear cardiology, which is, you know, doing stress testing, you know, whether that's exercise treadmill stress testing or nuclear stress testing. And then I had this cardiac MRI background. And like I said, I'm going to be doing some additional training in advanced echocardiography and then brushing up on my MRI skills. So that's kind of how all that started. And I'm hoping to make a true career out of it. All right. Is chemical engineering a good pre-med path? Honestly, I think anything, if you want to do chemical engineering, man, props to you, because that sounds really hard. But I presume within chemical engineering, there are some science courses that you have to take. And just check with your like counselor, whether in high school before you go to college or when you're in college, what pre-med courses you just need to take. But honestly, you can do whatever major you want. As long as you just take the appropriate pre-med courses, I think you're fine. Why did I pick non-invasive cardiology? I think I kind of covered that versus invasive. I do like doing certain procedures, but honestly, doing procedures all day and night is also not that much fun for me. Also, how do you deal with being a woman in the medical field, especially in cardiology when it's male dominated? That's a really good question. It is definitely a male-dominated field, and that's something that we battle with on a day-to-day basis. You know, there's actually a new statistic that came out. So back in 2018, there was only 12% of board-certified female cardiologists in the United States. Think about that, 12%. And if you think about how many medical students are that are female, there's almost 50% of medical students in the United States that are female. And then from that, under 50% of internal medicine residents are female. Under 50% of internal medicine residents are female, and that goes to only 12% that go into cardiology that end up being cardiologists. And that includes, you know, invasive cardiologists, electrophysiologists, you know, that are female. So that's a really disappointing number. And so, yes, it is a hugely male-dominated field. And I think one of the reasons why is because, you know, people have this misconception that you're working all the time. You're not going to be able to have a family. You won't be able to have kids. You won't be able to be married. You won't be able to have a life outside of the hospital. But that's not true. And so one of the reasons why I joined, you know, social media, you know, from a public aspect is really to kind of help demolish that, you know, misconception, because women can do whatever they want to do. You can create your own work-life balance. So, you know, our thing is that if you have a passion in doing something, do it, because that's what's going to make you happy for the rest of your life. It doesn't matter what it is. You can be a neurosurgeon and be a female and live a great life, right? You can create the life that you want, but don't ever let anybody deter you from doing what you want to do just because their opinion is different than what you want to do with your life, right? So we really try to tell that to future generations. And I love doing things like this because I want to inspire future generations to know that they can do whatever they want to do. You know, I have a great work-life balance. I don't work that, you know, I don't work 24 hours a day. I have calls sometimes and that's fine, but then I'm off a lot of times too. And I enjoy my life. And, I hope to get married and have kids one day. And, my career will, change depending on how I want it to change. And, more people are accepting of that. So, so that's one thing. And then, I've been told multiple times in the past, this is not going to be the right field for you. You're never going to be able to have a family. You won't be able to have, do this or that. And I never listened to anybody. And then, just being a woman in general, anytime I go into a room, let's say half of the time I go into a room and I introduce myself as doctor, the reply back is, hey, hun, hi, sweetie. Oh, hey, dear. Oh, the nurse is here. Oh, the PA is here, or, oh, the assistant is here, even though I introduce myself as a doctor, or they question your credentials. You're too young to be a doctor. How are you able to be a cardiologist? Are you sure that you have, enough training? Like it's crazy, but I know that I've sent in male medical students or male residents in, rooms before, and they're treated with more respect than I am. And that's unfortunately, this is the culture that we're dealing with, and this is a culture that we have to break. But, if somebody calls me dear or hun or sweetie or whatever, I correct them and I say, no, I told you my name is Dr. Mohamed, it's Dr. Mohamed, and you can call me that. You have to reinforce what you are, and nobody can take that away from you. Like nobody can take away my degree, my training, my credentials. I have 4 board certifications. Nobody can take that away from me, right? So when you remind yourself that you belong where you belong, and you remind yourself of that every single day, all of this little minutia that people try to, say or do to you that tries to bring you down doesn't really, matter, because I know that I'm, qualified enough to be here. So, I mean, it's difficult, but it's definitely changing. All right, I'm going to try to answer a couple more questions because I know time is running out. So, how did I know I wanted to pursue medicine? I honestly just knew ever since I was a kid. There's really like no other answer around it. I knew since I was a kid. I remember my mom and my dad like bought me like a little doctor's kit when I was like 5 or 6 years old. And, I would mess up like all of my stuffed animals and stuff by like performing surgery on them. And that was me. So I always knew, and I already kind of told you guys about my path as to how I kind of wanted to go into cardiology. A lot of male, female and questions. How did you keep on top of all the advances happening in cardiology? So that's a good question. It's definitely difficult to keep up with the advances in cardiology. I will say that social media is helping a lot. So when I was a medical student and in training, social media really wasn't advised for us. It was kind of, people kind of told you not to do it. Don't go public on social media. Don't use social media for, whatever purposes aside from, personal stuff. Like don't exploit yourself on social media. And so now I feel like medicine is so huge on social media, for Twitter. That's kind of how I'm able to keep up to date with a lot of stuff, because a lot of my colleagues on Twitter, everybody's talking about the newest guidelines, the newest clinical trial, the newest research, whatever. And so, and they summarize everything so well, is that you can just search a hashtag and then you can go ahead and look at, a certain article and be like, oh, this is what's going on in this and this. You're never going to be able to know everything. You have to be comfortable with not knowing everything. I'm definitely comfortable with not knowing everything, but I constantly try to educate myself to be better. I would really encourage you guys, especially at your stage and moving forward, when you go into, medical school and early years in your training, go on to social media, but do it for the right purposes. And, you'll find a great sense of community. You'll be able to learn so much. The education on social media, whether it's Instagram, Twitter, even TikTok, I mean, it's crazy, right? Like people are doing so much. And so, and I feel like by the time that you guys, come to, being physicians, it's going to change that much more. So use social media, but use it responsibly. And I feel like it's definitely such a great utility in terms of, expanding your career, helping you in your training. You never know the types of people that you meet. Let me tell you, I went public on social media maybe like 3 months ago. The opportunities that I've gotten so far and some of the leaders in my own field that I've been able to meet, that I never thought I would have an opportunity to do so has like completely changed the game for me. So like I said, use it, but use it responsibly. All right, let me try to answer a couple more questions here. Okay, how long did your schooling, residency, and fellowships take? I started high school back in, oh my God, you guys, 1998. I graduated high school in 2002. Oh my gosh, I feel so old. I graduated high school in 2002. And then I went to UC Irvine for undergrad. So then I graduated after 4 years. That was 2006. I took like 6 months off. And then I went to the Caribbean for med school. The reason why I decided to go to the Caribbean was honestly, like, I felt like my grades were not that great to get into US med school. So I didn't even try. I did my own research. And I remember I took my mom to like a seminar for this Caribbean school. I only applied to one and, you know, I got in. And so then I started medical school in like September of 2007. I graduated in June of 2011, and it's kind of just been straightforward since. I will say not that straightforward, because after I graduated residency in 2014, I applied for fellowship the first time to cardiology. I didn't match. I was devastated. I went through depression, the whole thing. And, you know, but I picked myself back up. I applied again. I had great research and I matched into my top programs. So by the time I finished everything, 2019. So it's been almost 15 years since I started. And I still, you know, decided to do a little bit more training. So my last thought is going to be, do not ever give up on yourself, please. Like, look at my path, look at my journey, follow me on Instagram. You guys will see I'm very transparent about what I've been through. And, you know, I want you to know, don't adhere to, you know, the world's timeline of what you should be doing. You will be able to do what you want to do. If you want to become a physician, you're passionate about it, I promise you it's going to happen. Yes, you will encounter hurdles, but you can overcome them and you can end up doing what you love. So thank you guys so much for having me. You know, I love doing this stuff. And if you guys want to reach out to me, please message me, DM me on Instagram. I'm at Dr. Ambreen Mohamed on Instagram. I'm happy to help in any way that I can. And I wish you guys so much luck and success in the future.
Thank you so much for coming. We really enjoyed this.
I hope it wasn't all over the place, because I literally was like rambling. So I'm
yeah,
sorry.
no, it was really